Hey y'all, it's your girl Tandrea, and welcome to today's 8th episode of Who Needs to Hear This Wednesdays. So today I'm going to talk about different kind of insurances and healthcare proxies, something I feel like everybody needs to pay more attention to instead of just being aware of. So everyone knows what life insurance is, but do you really fully understand it? A lot of people just don't want to be bothered with it. Oh, they feel like they're gonna jinx them or they kids if they get it. Time waits for no man, and tomorrow is not promised. So you should definitely invest in life insurance. Even for those that may have life insurance or is thinking about getting it, you need to understand what you're worth and how much your premium is. So that way it is a smooth transition if you, when you finally do perish. What I mean by understanding your premium, you need to know how much of a policy you're investing into. Is this house paid off? Do I have enough in this policy for my kids to pay out the rent until they can find something else? Or is this car paid off? It's a lot of things. You know, how much is your funeral going to cost, depending on how big of a funeral you want to have. So it's definitely a lot of things that people need to take into consideration when actually investing in getting life insurance. So everyone pretty much has health insurance. That's kind of basic, but supplemental insurance is something else that people need to be aware of and invest in. When I mean supplemental insurance, you have long-term disability insurance, you have short-term disability insurance, you have accidental death dismemberment insurance. So when enrollment at your job comes around and they have these other small things, that they are definitely worth investing in, especially now with this pandemic. Short-term disability is definitely coming in handy. Whenever you have to go off work, whether it's for COVID or family issues or something medical related, ladies even getting snatched up, you are entitled to state disability. State disability is only going to pay you a certain amount. That's where that supplemental disability comes into play. That STD, that short term disability, not STD, not the sexual one that some of y'all only know about. I'm talking about STD, short term disability. Is supplemental, meaning it's going to supplement the income that New York State or whatever state you're in is going to give you. I'll give you an example. When I went off work, not too long ago, New York State disability only paid me $600 for the month, for the whole month that I was off. The supplemental disability that I paid into, they paid me an additional $900. So therefore, that made my monthly income, 1,500. Just to give you an example of how it supplements the insurance, the state insurance that you're entitled to. And depending on what state you're in, again, you got to look up the laws of your land. The amount differs for every state. So that do your research and Google it. But definitely it comes in handy if you get COVID or anything, or if a relative gets sick or has COVID and now you got to quarantine for the 2-week time period or more. Is very unexpected. That's where that short-term disability kicks in. So definitely something to think about, something to look further into and invest in for yourself. It's really not that expensive. It automatically comes out your check. You won't even notice the difference. So now let's talk about something a little bit more in depth. Your healthcare proxy. Your healthcare proxy is just more than your emergency contact when you go to the hospital or on paperwork. Your healthcare proxy is over your life. Everyone should have a living will and a regular will. A living will is what you want to happen to you when you cannot speak for yourself, how you want people to either keep you alive or to end your life. A regular will is what you want to happen to your assets after you perish. So it's two separate things, but your healthcare proxy is to carry out your living will. Your living will is what you want to happen to you when you cannot speak for yourself. A lot of people do not want to get resuscitated DNRs, and that is up to the healthcare proxy. But you have to make sure whatever decisions you want for yourself when you can't speak for yourself, that your healthcare proxy is in line with. This person loves you. They don't want to see you go. However, you have to make sure that they're one, strong enough mentally and emotionally to carry out your wishes. Two, you have to make sure that they are religiously in tune with what you want to happen. I grew up in a religion where they do not accept blood. And I was in agreement with that once upon a time. But now that I have children of my own, yes, I'm willing to take any medical directive to build up my own blood. But now that I have kids and I am over them and I am their living will at this point, I see things a little differently. And when you have a religious person over you and y'all aren't aligned in thinking, now I have to reassign someone to carry out my wishes. So you definitely have to have an alignment with whoever you have over your living will. Also, make sure that all of your beneficiaries are updated, their demographics. If they perish before you want to make sure that this money goes to a rightful person, somebody who's going to take care of, again, your wishes as you want. So always, always, always be in line with your beneficiary, be in line with your healthcare proxy, and keep their addresses and their phone numbers updated, because again, you never ever know. So this is just some things to keep in mind, to make sure that not only are you okay while you're living, but that you also have a smooth transition with not only your wills, your wants, and your assets when you go. So you already know how this go. Tag a friend, tag a foe, tag a bitch, tag a hobo, whoever you tag, make sure that they in line with what you want while you living. Y'all be easy and make sure you get life insurance and that you get your short-term disabilities, especially with this pandemic. You never know what's going to happen. So y'all be easy.